Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Good morning, and I'm Maggie Ornazian. Welcome to Boomer Health at Home. I'm currently the Director of Nursing at AmeriStaff Nursing Services. We're here again today with Megan Gervin, Nurse Supervisor at AmeriStaff Nursing Services. Today we're going to be talking about the topic of vaccines and why we should get them. Good morning, Megan.
Good morning, Maggie.
So as a home care nurse, what type of role do you play in recommending vaccinations and why?
Well, really, as a home care nurse, we are the front line of public health. We are in their homes. We are there to help guide them so that they can have a super active, long life ahead of them and actually stay in the home, have a good quality of life. Vaccinations are extremely important in that to help prevent illness, prevent them from having to be hospitalized to come out of their home.
So what is, for someone who doesn't know, what is a vaccine?
So vaccines are a germ, essentially, that they take. They either weaken it, they kill it, or they use part of it, and they build up this vaccination. What we do with the vaccination, it goes into your body with a shot, which can be unpleasant, but most shots are. The illness is a little more unpleasant. When it gets injected into your body, it actually forms antibodies, and those antibodies will help fight off that disease when you are exposed to it. So it builds up an immunity to it without you having to go through the horrible disease process.
Okay, so what are the common vaccines that, I know the flu is one of them. We talk about every season. There's, the flu season from October to, I think it is February mostly here. So what are some other common vaccines that we hear about and that people should be receiving?
So there's different ones throughout your life. When you're a child, we all got this beautiful series of shots that, take you to the doctor and you get to get a sticker afterwards. But as you go through life, they will give you some boosters. They will remind you, you need to get your measles, mumps, rubella booster. As you get older and you get into more of a senior population, the pneumonia vaccine becomes extremely important to get, and your shingles vaccine. I mean, shingles can be extremely painful. They sit on your nerve root, and no one really wants to get that. So.
Where are some places besides the hospital, if you're there, can you receive the flu shot or any vaccine?
So most of the places you can go, your doctor's office, you're already there for your appointment. They can give you your vaccinations while you're there. Other places, the health departments, you can go to your local pharmacy, your local grocery store while you're out getting eggs and milk. You can stop over to the pharmacy inside your grocery store and get your flu shot.
Okay. So now we're going to talk about the elephant in the room. I don't get the flu shot because it makes me sick. Or I'm not going to get the flu shot because my nephew is autistic and he became autistic right after the flu shot. So what do you say to that? How would you educate someone a little bit more about vaccines?
So there's a lot of controversy around vaccines. A lot of it comes with a lot of scare tactics that are online.
Okay.
There's a lot of people out there that have heard these rare side effects that can happen from a vaccination, and they blow it up larger than what it really is. They blow it up and scare people online, and a lot of times these people have no scientific or medical background. They really are your lay person that heard a story, they share that story, and really it's just their opinion. So without going to your doctor and understanding it a little bit better, it's a scare tactic, and it's working, unfortunately. A lot of people between 18 to 64 years old, per the CDC, are getting mixed reviews on whether or not vaccinations are actually good for you. Unfortunately, this kind of stops people that are at risk, those groups that are pregnant, have a lower immune system. That type of population aren't getting vaccinated and are putting themselves at a huge amount of risk.
Okay. So the CDC does recommend that we do get vaccines.
The CDC does recommend.
Okay. Okay. And should we consult our physicians before we get any vaccinations?
You should always consult your physician. They know your personal history. They know if it's safe, if you're able to get your vaccination at this time, or maybe they want you to wait, 2 months to get that specific vaccination. They can help you time them out, and they're looking at the bigger picture. They're looking at, the Maggie picture, and they can help you decide, yep, it's now, or nope, we need to wait a little while to get this.
So in your clinical opinion, do you think that it's important for seniors to receive the flu shot?
Absolutely. It's extremely important that seniors get this. Unfortunately, I've had to see the flip side of this where it was very bad. I've had to take care of patients that were dying from the flu. Many did die from the flu. Unfortunately, last year I think it was over 61,000 people died from the flu. And it's an extremely preventable thing. Otherwise, even people that live through it, you're on a ventilator sometimes. You have it attack your heart. You have all these long-standing, debilities from it, and you could have just gotten a shot.
Jeez. That's very interesting. And that's what you don't hear about.
Yes. You don't hear about those horror stories of, I didn't get the vaccination.
And this is what happened.
And this is what happened.
Wow. Okay. So I'm going to flip it back to shingles again, because you were saying it's very painful when it's right on the nerve. Is that correct?
Correct.
So at what age should people start getting the shingles vaccine?
So over 60 years old, you can start getting the shingles vaccination.
Okay.
And your doctor should prompt you for that. You will start hearing about it. They'll suggest that this may be coming up. It may be time for you to get this.
Okay. And then, so I have a big family. They're all coming into town this weekend. They're all going to tell me that the flu shot makes them sick. Tell me what I can tell them, so I don't look like, oh, okay, so we're just going to pass that by now.
Yes, so many people will say that they get sick from the flu shot. This is somewhat true because they feel sick. You may get a headache, you may have a fever, you may have muscle aches. The good news is it's working. That means it's completely working. You're building your antibodies up. If you're not having that reaction, it may not work as well. So what your body's doing is taking all of that immunity buildup, and yeah, you may feel like junk for a couple days or even just one night. Now, if you do get sick in the time period, it does take 2 weeks to build up those antibodies in your system. So unfortunately, if you do catch the flu within that time period, you will still get the flu, you will still get sick. It's not the flu shot's fault. It's actually just extremely bad timing, and it just stinks.
So don't blame the flu shot.
Don't blame the flu shot.
Okay.
It's not its fault.
Okay. And now with the pneumonia vaccine, what is the CDC's recommendation for the pneumonia vaccine? At what age? Because there's a lot floating around in the internet about that right now. At what age, and is it a lifetime? What is your recommendation on that?
So it's recently changed, so I think it's confused a lot of people.
Okay.
It is still over 65 years old is the recommendation for seniors. Under 2 years of age, they still get a series of shots as well.
Okay.
Now there are 2 different ones now on the market, and that's what recently changed. It used to be one that was given 5 years apart. Now it's changed to 2 different vaccinations that are just given a year apart from each other, and it should give you lifelong immunity. Now, if you are one of those wonderful people that live to 104 years old, your doctor may decide that you need to get one more just to protect you. It may wear off a little bit. If you do have any autoimmune disease, you are part of a population that may contract it between that 2 to 64, your doctor will prompt you. They will tell you you need to be vaccinated for this, and they will help you get vaccinated for that.
Okay. So there's really no time frame with the pneumonia. You don't need to get it, in the winter months or anything like that. It's basically follow your doctor's recommendation.
Follow your doctor's recommendations. Okay. A lot of times they'll try to time it, they'll try to catch you. A lot of times at the hospital you'll be asked, would you like to get your flu shot before you go home? You can get those vaccinations then, or you should be following up with your doctor and get them at a later time. There's no time period throughout the year. If you want to get it in summer, you want to get it in winter, you can make that choice.
Okay. But adversely with the flu shot, it's seasonal. So the CDC recommends before the first frost, as they say. So that would be around this time of year if you live in Michigan, correct?
Correct.
Okay.
So with that, they do recommend by the end of October usually.
Okay.
It does take 2 weeks, like I said, to kick in. So you want to give that amount of time before everyone's coughing on you in a grocery store and putting their dirty hands on stuff. You want to make sure you're protected from it so that you don't end up getting sick when you've already had the flu shot.
Correct. Okay.
So
you were saying that they offer these in the hospital if you do get admitted for some other type of diagnosis and or illness. What do insurances, not what, I'm sorry, do insurances cover these shots?
Many insurances do cover the shots.
Okay.
You should always check with your insurance provider. There are little things inside of insurances that a lot of people just don't understand. You can always call your insurance company and find out. Medicaid does cover all vaccinations. Different Medicare plans cover specific ones, like you have to have D to cover shingles. The good news is that with they want you to get your vaccination. So there's so many different programs out there to where you can still go get vaccinations for free or at a reduced cost. And that's your, health department, CVS, even your local grocery stores have free flu vaccinations. So there's different places that you can go without having to pay, without having an exorbitant cost. If you do have a cost, just keep in mind, it's way less than a hospital bill. It's way less than your doctor's bills. So that price of that vaccination really, when you price it out, is not that costly.
Okay. So what are the 2 best ways we as a community can help prevent the flu this season?
So hand washing, you're going to hear that all over the place. You're going to see signs up. It's for a reason. Hand washing is one of the biggest things you can do to help protect your health. Wash frequently. I mean, you can watch videos on how long to do that. Sing the ABCs while you're washing your hands, different things. There's all sorts of educational videos out there. And really, try to stay away from sick people. As much as you're in a household with people, there's a lot of different things, respiratory viruses especially, that travel on droplets through the air. It is airborne. So sometimes you can avoid it, but a lot of times if you know your family or your friend is sick, don't go over there. Don't get very close to them. Drop something off on the porch as a little care package, ring the doorbell and run away.
Right.
It's totally acceptable.
Okay.
We want to make sure that people stay healthy throughout the year.
Okay. Why do I sometimes see people with masks on in the hospital?
So part of that,
What's that about?
Is that airborne. So putting a mask on, a lot of times you'll see the nurses have them on walking down the hallway. There's different viruses that travel through the air.
Okay.
The flu, the human metapneumovirus, a lot of these that travel on droplets. Even your common cold will fly through the air and come after you. So by wearing a mask, they're blocking those droplets. So what they're doing is help to prevent passing it on to somebody else. Okay. So there are other different people that do have a weakened immune system. Maybe they're on chemo, maybe they're on an immunosuppressant drug, and they're very worried about getting sick because they are at such high risk. Their immune systems aren't working to fight off these infections, and there's so many out there now that they can't be protected against everything. So people may wear a mask around to help protect themselves from getting sick.
Okay. And then I have one final question for you. A lot of people will say, oh, I don't want my shoulder to hurt. Can you do it over here? I write with this arm. Why is it that when we do get vaccines, or actually any shot, sometimes I feel like in my arms, they always ache after and hurt for like a day or two? You can really feel it.
You really can. Part of that is you just got stabbed with a needle. That never feels good. It's just not a pleasant sensation. The big thing though is when it gets injected into that muscle, your antibodies are building in there. That's where your body is flooding your good stuff over there to start building up your immune system against that.
Okay.
Now, getting it in the arm that you do right in is a good thing. You are going to move it around a little bit more. You are going to spread it out a little bit more. You tend to use your dominant arm way more than your other arm, so that may help some of the stiffness, but it's just part of it. It's making your body immune to all those horrible diseases and illnesses out there. So.
Okay. So for the protection of all these vaccines, I know that the flu shot is seasonal. With all of my family coming into town again, we have a baby coming. The whooping cough, is that something that if you received it as a child, you don't need to receive it again?
So you do have to get boosters for certain vaccinations. The
Okay.
whooping cough is one of them that you have to continue to get throughout life.
Okay.
So a lot of times it'll be combined with your tetanus shot, which everybody knows that one because you do get that nice sore muscle from it. But they have changed recommendations slightly because it did come around again a couple years ago. It's not a very pleasant thing. I did take care of patients with it, and it's a true whooping down the hallway. Now passing it on to children, it can kill them. So it's very important that as adults we protect our children that can't necessarily get the vaccinations or they can't protect themselves. So it's kind of like that herd immunity effect where people can get vaccinated and help protect the other people around them that can't get vaccines.
Right. Okay. And then with shingles and pneumonia, are those one-time doses?
So shingles is a one-time dose. Pneumonia, sometimes you have to get little boosters of that later in life.
Okay.
But it's usually just 2 shots. Now the flu, they will tweak that one every year depending on what was in the air last year and what they think is going to come out this year. So every year, that flu vaccination, it's a little bit of a jerk and it tweaks itself to try to capture us the next year and get us sick the next year. So that's why it's so important that every year you get your flu shot because it's different every year.
Okay, great. Well, thank you, Megan, so much for your time.
Thank you.
We really appreciate it. That brings us to the end of our show here at Boomer Health at Home. My name is Maggie Ornazian, and again, please feel free to contact AmeriStaff with any questions at 248-288-2270. Thank you, and have a great day.